For many seniors over 60, there are daily habits that may seem innocent at first, but over time, they begin to chip away at both heart health and self-confidence. Doctors often observe that older adults struggle not only with medical conditions, but also with subtle behaviors that quietly harm their physical and emotional well-being. These are habits that doctors would never recommend because they not only affect blood pressure and circulation, but also reduce motivation, happiness, and the ability to follow healthy routines. Some of the most common include skipping breakfast, sitting for long hours, neglecting personal grooming, eating processed foods, and avoiding social connection. While these may appear harmless, they can block the positive effects of healthy recipes meant to support heart health, manage high blood pressure, and reduce the risk of heart failure. Many seniors believe that taking medication or eating a vegetable once in a while is enough. But true heart health comes from consistency. When these damaging patterns continue unchecked, they increase the likelihood of issues like congestive heart failure, heart attack symptoms, and poor emotional health, which often go unspoken. My name is Dr. Anthony, and I am a heart health specialist who has worked with seniors over 60 for more than 20 years. In my practice, I have seen how deeply everyday behaviors can influence outcomes when it comes to preventing high blood pressure, improving circulation, and protecting heart function. The key is to recognize the habits that slowly wear you down and replace them with ones that lift you up. Welcome to Wellness Daily 365, where we share practical science-backed strategies to help older adults live longer, stronger, and more independent lives. Every week, we offer new health tips designed to empower you with knowledge that can truly change your life. We believe that aging should not be about decline. It should be about discovery and growth. If this is your first time here, I encourage you to subscribe and leave a comment. Your voice matters, and your experience can help others. As we age, it is important to understand how small decisions build over time into either health or disease. For example, skipping breakfast leads to low energy and blood sugar spikes, which put extra strain on the heart. Sitting all day weakens the muscles that help pump blood and makes it harder for oxygen to reach the brain. Even ignoring grooming may sound minor, but it often signals low mood or lack of self-worth, which are both linked to a higher risk of heart problems. These behaviors do not just affect appearance, they damage confidence. And when you feel less confident, you are less likely to take control of your diet, activity, and medications, which are essential parts of any high blood pressure treatment. Many seniors fall into a cycle where they feel tired, stop moving, eat less nutritiously, and isolate themselves, which only makes heart health worse over time. At Wellness Daily 365, we have seen that changing even one of these patterns can make a dramatic difference. Starting your day with a healthy breakfast, walking for 10 minutes, brushing your hair, preparing a simple healthy recipe. All of these are signs that you still care for yourself and that care helps the heart beat stronger. Part of our mission is to remind you that your value does not fade with age. Your body still responds to care, and your heart still wants to thrive. This is why we are passionate about showing seniors that small daily actions matter more than they think. In the next sections, we will dive deeper into why these hidden habits form, how they affect the heart, and how to replace them with better choices. By the end of this article, you will have a clear understanding of what doctors really want seniors to avoid and what they wish more people over 60 knew about rebuilding confidence and protecting the heart. If this message speaks to you, we hope you will follow Wellness Daily 365 and join a growing community of people who want to age with strength, clarity, and hope. Understanding why harmful habits form in seniors over 60 requires looking beyond the physical symptoms and into the psychological and emotional roots of behavior. As people age, they often face new limitations, such as chronic pain, mobility issues, vision problems, or memory lapses. These challenges can slowly reduce motivation, which leads to a drop in activity, personal care, and social interaction. Over time, these patterns become normalized, and many seniors stop noticing how much their routines have changed. Doctors often find that the root of poor heart health is not just diet or medication adherence, but a hidden lifestyle drift that goes unaddressed for years. For example, someone who once cooked healthy recipes daily may now rely on processed frozen meals or skip meals entirely. This not only strips the heart of essential nutrients, but also leads to blood sugar swings, inflammation, and high blood pressure. When left untreated, this can contribute to heart failure, especially in people who already have congestive heart failure or early heart attack symptoms. One major factor is learned helplessness. After years of dealing with loss, illness, or physical decline, many seniors begin to believe they no longer have control over their health. This mindset discourages positive behavior, reduces energy, and makes it harder to engage in daily health tips like walking, stretching, or drinking water in the morning. The body responds to neglect, and soon blood vessels stiffen. Circulation slows, and energy levels drop. Inflammation rises, which places additional pressure on the heart and raises the risk of stroke and other cardiovascular events. Yet the good news is that these effects are not permanent. With the right support, seniors can reverse much of the damage. When we help someone believe that change is possible, we activate a powerful part of the brain responsible for motivation and healing. In my practice, I recall the story of Mr. Harold, a 74-year-old man who had recently been hospitalized for congestive heart failure. He was on multiple medications, had high blood pressure, and reported frequent shortness of breath. His wife had passed away 5 years earlier, and since then, he had slowly stopped cooking, shaving, or walking. When I first met him, he looked defeated. He said he had no reason to care anymore. We started small. I encouraged him to begin each day by drinking a glass of water and taking 3 slow breaths before getting out of bed. Then we added a 10-minute walk every morning and introduced 2 healthy recipes per week that he could make in under 15 minutes. Within 2 months, his energy improved, his blood pressure stabilized, and his confidence returned. He began smiling again, started shaving, and even joined a local group for men over 60. This is the transformation we aim for at Wellness Daily. The body can heal when the mind begins to hope. Changing habits is not about willpower, it is about understanding the cause and replacing it with something meaningful. The problem is that most seniors do not receive guidance on how their behaviors affect their heart health. They are told to lower salt, take pills, or lose weight. But no one explains how loneliness, grief, or boredom can block their motivation to follow those recommendations. That is why we emphasize full support, not just with nutrition and exercise, but also with emotional tools. Building a healthy lifestyle must start with understanding the person as a whole. If someone feels isolated or ashamed, they will not try new recipes. If they feel hopeless, they will not check their blood pressure. But if they feel seen and supported, everything changes. That is why every health tip we offer includes simple emotional and practical steps. Whether it is walking with a neighbor, writing in a gratitude journal, or learning the difference between heart attack symptoms and fatigue. These moments may seem small, but they can change a life. The heart thrives when the body moves, when the mind is calm, and when the spirit feels connected. If you or someone you love is over 60 and struggling with motivation, please know that there is always a path forward. And if this message resonates with you, leave a comment below. Let us know your experience or question, and subscribe to Wellness Daily 365 for ongoing support and encouragement. Improving heart health in seniors over 60 does not require perfection. It requires consistency. Each day brings new opportunities to support your heart, restore your confidence, and protect yourself from conditions like heart failure. The first and most important habit is hydration. Drinking a full glass of water shortly after waking helps improve blood circulation. Reduce the workload on your heart and lower the risk of clot formation. Dehydration can cause your blood to become thicker, forcing your heart to work harder and increasing your chance of complications like stroke, high blood pressure, or congestive heart failure. The second habit is eating a nutritious breakfast. Skipping breakfast causes your cortisol levels to spike, disrupts blood sugar, and weakens energy levels throughout the day. A heart-healthy breakfast could include oatmeal topped with berries, flax seeds, and chopped walnuts, or a vegetable omelet with spinach, tomatoes, and olive oil. These healthy recipes are rich in fiber, antioxidants, and healthy fats, which reduce inflammation and improve blood vessel health. Third, daily movement is essential. Seniors do not need to run or lift weights, but light activity such as walking, stretching, or using stairs can help maintain muscle strength, stabilize blood pressure, and boost circulation. If walking is difficult, even seated movements and deep breathing exercises can support heart function and improve oxygen flow. The fourth factor, sleep. Going to bed before 11 p.m. and maintaining a consistent bedtime helps regulate hormones, reduce blood pressure, and support overall heart rhythm. Poor sleep is linked to elevated risk of heart failure and high blood pressure. Avoid screens late at night, dim the lights after dinner, and create a calm environment that tells your body it is time to rest. In addition to physical habits, seniors must also protect their emotional and mental well-being. Chronic stress, loneliness, and depression silently damage heart health. Connecting with others through phone calls, hobbies, or community events can improve mood and reduce cortisol levels. Even writing in a daily journal or practicing gratitude can improve heart rate variability, which is a strong indicator of heart resilience. For better results, combine these daily practices with your existing medical treatment. If you are on high blood pressure medication, make sure to take it consistently and ask your doctor if your treatment plan needs adjustments. High blood pressure treatment works best when combined with lifestyle changes that include movement, nutrition, hydration, and stress reduction. At Wellness Daily, we believe that confidence is the foundation of lasting health. When seniors feel empowered, they are more likely to cook healthy meals, take their medications, stay active, and speak up about their symptoms. Confidence drives action, and action supports healing. That is why we encourage you to begin with small but powerful changes. Drink water in the morning. Take a short walk. Prepare one healthy recipe each day. Talk to someone you trust. Each of these steps strengthens your heart and your spirit. Healthy aging is not about doing everything perfectly. It is about choosing what helps you live longer and feel stronger. If you need simple meal ideas, try preparing a salmon and broccoli bowl with brown rice or a lentil stew with carrots and turmeric. These recipes are easy, affordable, and packed with nutrients that support heart health. You can also prepare snacks ahead of time, such as chopped vegetables with hummus or apple slices with almond butter. Staying prepared helps you make better choices even when your energy is low. Finally, let this message remind you that your age does not define your value. Your heart still matters. Your choices still matter. You still matter. If this article helped you or inspired you to make a change, please subscribe to Wellness Daily 365 and leave a comment below. We would love to hear from you, answer your questions, and welcome you into a community where heart health and senior confidence are our top priorities.